And with that, so we are narrowing down to the last half hour of day 2 of the HITLAB Summit. And we are really excited to have on board here, a nice transition from Dr. Rana coming in from Australia to talk about leadership, to now talk with Meg Barron from the American Medical Association. And she leads the digital health strategy side of what the AMA is doing in digital. Obviously, America's largest medical association and medical society for over 100 years, and just doing tremendous work in helping lead the physician community through this digital health reset, as is the term for this year's summit. And there's a number of findings in the AMA's landmark report that it came out with earlier this month, and we're looking forward to dive into that. That's the kind of data that anyone who's evidence-based, such as HITLAB and our community, loves to see. Hi, Meg, how you doing?
Hey, Stan, how are you? Thanks for having me.
No, thanks for joining us. Know how busy you are, and obviously this is a very busy time of year at the AMA, and you've got the RSNA in town, and there's about 800,000 radiologists descended all over town talking about tech, so that's always fun. Again, for those of you who aren't familiar with RSNA, it's the Radiological Society of North America. It's about 100,000 person conference every year in Chicago, which is around or near where Meg is. Meg, your background is different than your lake house in Lake Michigan. Are you back in Chicago now, or are you still on
I'm actually in the suburbs because I have been tasked with babysitting my nieces while my brother and sister-in-law are in Mexico. So I'll go pick them up from daycare right after this for the rest of the week.
Well, good for you. You're truly doing higher work. That is the most important job out there, no doubt about it.
That's right, right.
So really appreciate you joining. Know we only have a short period of time, and really looking forward as an audience to hearing about your report. So going off camera here, and we'll hand over the virtual podium to you to discuss.
All right. Well, thanks again, Stan. And thank you everyone for being here. Again, I'm Meg Barron. I lead our digital health strategy and innovation work at American Medical Association. First, just a bit of context. So at the highest level, our digital health strategy is focused on how do we help to make technology an asset and not one more thing or one additional burden for patients and physicians. And as we all know, there's a lot of lessons learned from the rollout and implementation of the electronic health record. And at the highest level, we're really focused on how do we help to improve the quality of digital health technologies and solutions, which again have multiple different definitions, and I think a lot kind of underneath that umbrella of digital health. And on the other side of the coin, how do we help to get scale, adoption, and really optimization at this point, since again, additional traction has been seen. So our work is directly focused on that. And really what we're trying to move towards is digitally enabled care. And it's not that we need another buzzword by any stretch of the imagination, but at the same time, I think there's recognition that we need to move beyond just virtual care and in-person care kind of coexisting, but more so, how do we make these as integrated and coordinated as possible? So that's our overall focus. As background, all of our work is really rooted in research, and dating back to 2016, when I joined the team, we ended up doing some initial baseline research to really get a pulse check for what physicians were using today, or in 2016, I should say, in practice, what they were excited, enthusiastic about, and then what their key requirements for adoption were. So that's been very foundational both to our strategy and the work that we do with external partners such as HITLAB and a number of others. We repeated this study in 2019, and then again just this year, which has been really interesting to kind of again see a trend line in a post-pandemic or moving towards a post-pandemic environment. In terms of survey instrument and kind of methodology, we've gone out in all 3 instances of this research to 1,300 physicians in all different geographic areas, age ranges, specialty types. The definition that you see that we landed on for digital health is at the top here, and more detail is in the full report. And then the 7 solution categories we asked about are also outlined here. So this had assumptions that everyone was already, of course, using electronic health records, but for things like RPM and telehealth and clinical decision support tool, that's what we really wanted to dig in on. So in this latest iteration that we just did, this is the top line. And we've seen some similar results, but of course, it's been very interesting to see the growth in adoption overall, but also enthusiasm as we move into this post-pandemic environment. Number one that you see outlined here is across the board, we've seen that physicians have seen an increase or have expressed an increase in the advantage that digital health tools and technologies provide them, both in patient care and even for efficiency's sake. We've seen growth in usage for all of the 7 solution categories and tools that we asked about. And some of the major drivers for that have really been around, how can this help me improve clinical outcomes? How can this help me improve efficiency in my practice? And with physician burnout at an all-time high, this is more necessary than ever. And really, technology has an essential role to play in helping to ensure that high quality care can be seen and really expanded from a patient access perspective. No surprise, I'm sure, to anyone in this group, but the areas where we saw the largest spikes in use were, of course, telehealth and also remote patient monitoring. I think one call out that you can see if you look at the full report is that RPM had seen significant growth, but it's still the least utilized of the 7 solution categories that we asked about. So I think that really speaks to opportunity, right, just in the market on continued usage and adoption there, especially with chronic disease being what it is. The other thing I'll point out is that growth and enthusiasm has largely been concentrated in telehealth. And I think you could see this going a few different ways. And this one somewhat surprised me, because if you take the electronic health record rollout and frustrations that really were expressed because of the kind of process of how that was rolled out, and sometimes without physician involvement or other care provider involvement in the rollout of it. Telehealth, on the flip side, enthusiasm is quite high, and physicians want to continue to be able to offer telehealth and virtual care in their environments. I think some of the areas that we need to focus on are continued reimbursement in this space and the coordination aspect of how best to optimize that with in-person care. And then lastly, we did ask about emerging technology areas such as AI, digital therapeutics. Awareness for these emerging technologies is quite high, but usage is quite low right now, with only about 1 in 5 using some form of AI, at least to their knowledge. That said, the kind of anticipation to use or adopt these is of interest, but I'll get to this in the next slide. Physicians are loud and clear that they have key requirements for continued adoption, and really, as we think about sustainability of this adoption in practice, and those really fall into 4 key buckets around: prove to me it works and is trusted and has an evidence base to it; prove to me that I will receive proper or fair payment if I use this or continue adopting or prescribing this in my environments; prove to me that there's liability coverage, so who's liable from a data privacy or security standpoint if I use this. Or the previous presentation was speaking about AI. And again, I think there's a lot of liability concerns related to that have to get further addressed. And then the last, but often the most difficult, is, will it work in my practice environment? So will it integrate with my EHR? Will it work in my workflow? Will it work with my care team? And at the end of the day, is this going to save me a minute of time or cause me to have 3 more clicks in an already really laborious process? I'll speak to a few of these things, but how we're helping to address this is we have a number of research initiatives, resources, and just overall initiatives that we make freely available and really come from a mission-focused perspective, really to help to ensure that these can be additionally optimized. And back to, how do we move towards digitally enabled care? Our focus is helping to provide as pragmatic of resources and initiatives as possible to address that. One initiative is called our AMA Immersion Program, and this really was birthed out of us working hands-on with a number of practices across the country to both stand up and adopt telehealth in their own environments across different specialty types, but then to really pivot towards that optimization piece, which again continues to be a work in progress. But we were getting great insights from that and wanted to be able to democratize that to a much wider audience. So we've got an immersion program that's freely available. We've got a whole library of different webinars and sessions that are out there. And we take the approach and have found what's been most helpful here is a sharing in more of a clinical case study perspective of what's working and then what's not working so well and how do we improve on this. So I would offer up for this audience to definitely check that out. From a vendor or organization perspective, oftentimes we're wanting to feature case studies too, or best practices that you're seeing, or how those are getting operationalized in various health system perspectives. So if you have your own case studies, we'd love to hear about them and potentially work that into our editorial calendar for next year. The next is AMA Physician Innovation Network. And the objective for this platform and network is myself, a team, we were playing a lot of manual matchmaking between physicians and companies. And that's exactly what we want. We want as much end user feedback, both patient and physician feedback in these emerging technologies as possible. So really you can think of Physician Innovation Network as more of a match.com to connect physicians and health tech innovators and companies all across the country. Companies can go on here, put opportunities that they have, be that full-time, part-time, or really just a pulse check if you're looking to get feedback on your problem statement or concept that you're working on. And then we've got over 18,000 users that participate on this. So again, a resource that's freely available for this community. The next is something that we rolled out as part of a recognition that virtual care, should be here to stay. And then what we were often hearing is from health systems and practices and different stakeholder groups is, well, how do I best quantify or really summarize the value that's being created from integrating virtual care into my environments, especially when the short-term ROI piece of that can sometimes be difficult because you have investments to make on the front end. So we created a virtual care value framework that we rolled out in 2021 with Manat Health to really help to do just that. And this looks at more of a comprehensive view of how value is being created beyond just short-term ROI. Well, of course, like financial ROI is always going to be a critical component, but more from a patient access perspective, from a patient and physician and caregiver satisfaction lens, from a clinical outcomes perspective, and also for health equity, and how that can be better summarized to really tell the story of how virtual care is creating value in your environment. This, again, is an area where we're collecting case studies. So if you, as a vendor, an organization, a practice, have case studies to share on this based on your environmental variables, we'd love to hear that and find ways to amplify what you're seeing in your environments. Then lastly, and I'll close with, just at HLTH a few weeks ago, we launched our latest research, which is focused on recognition that, of course, value is getting created from the integration of these new technologies and tools such as virtual care. At the same time, there really seems to be what we've termed this digital health disconnect of how do we best really align, of course, in-person care and virtual care for optimal results. And we also recognize that given the various stakeholders that are involved in this, we need to find ways to better partner and collaborate if we're going to be able to see the best results. And now more than ever, back to physician burnout being at an all-time high and really the tsunami of need for both chronic care and behavioral health, we have to find ways to do that. And we have to find ways to better amplify what is working and almost create a case study showcase of sorts of where successful partnerships are happening. So we've launched this research. This is a QR code to be able to download that. Once again, we're wanting to take a very collaborative approach, and we've had over 40 plus contributors end up sharing different scenarios that they've seen in their environments. In 2023, we're going to be doing a number of additional convening sessions on this topic. So we'd love, as a call to action, to hear from you. If you've got best practices, case studies that you can share, we'd love to include you in that and look forward to, again, hearing what you're seeing in your own different scenarios across the country. So we feel like this is incredibly necessary. And again, we'll look to HITLAB and others that are participating on the call today to help join us to make that happen. So Stan, thanks so much for including me today.
Of course, Megan, thank you for joining us. We know how busy you are and we appreciate your time, and certainly would love to take any questions from any of the audience. I think we have 1 minute left or so, but just checking on the Q&A board, and then let me just jump over to LinkedIn since a lot of folks come in that way. But in terms of your vision for what you're anticipating based upon the trends you've seen over the last few years from your research work here, what are some of the things that you're envisioning if you were to say, the telemedicine or remote patient monitoring, something like that? Are you seeing the adoption of those technologies push up into the mid double digits, or are you seeing them based on what your results are showing, trending and staying back into the high single digits to the low double digits?
Yeah, I think it really depends based on kind of specialty and practice setting area. I mean, reimbursement is so critical, right? And also that workflow integration piece. So my hope is that we don't see more rollback of declining, telehealth and virtual care, because again, from both a patient and physician perspective, we know that the interest is there to adopt and that there's enthusiasm to additionally adopt, and that we're just kind of brushing the surface of what's possible for that. And again, remote patient monitoring, there's just so much potential. There's also CPT codes available, right? That reimbursement is an option. I think the biggest hurdle for that is the workflow coordination piece of it, and that it takes a breadth of time. And when people are so overburdened right now, that breadth of time is a luxury, right? And to be able to have a reflection moment to say, how could we be reaching more, having additional patient access or improved outcomes? And that, I think, speaks to that return on health value framework that we looked at, that first and foremost, you kind of have to quantify the current state and then think through where are opportunities to kind of plug in technologies and then quantify any success or outcomes on the back end. And I see in the chat here that I'm happy to put a link once I get off here to the Future of Health report.
Okay, yeah, that's fantastic. Well, thank you again, Meg, and looking forward to catching. Are you going to be at JP Morgan Healthcare in San Francisco?
I will be at CES, but I think I'm going to be skipping JPM this year. So I'll put the links to all of this in the chat I'm seeing here. But yeah, I'm looking forward to seeing you, Stan, soon. Thanks again for the opportunity.
No, thank you again, and have a great holiday. Have a great New Year. Take care.
You too.